I am now pleased to introduce our first speaker, Paul Gionfriddo, President and CEO of Mental Health America. Paul is a passionate health and mental health advocate and brings a wealth of experience and expertise from his work in the public and private sectors, including serving on the National Advisory Council to the SAMHSA Center for Mental Health Services. We're so grateful he's with us today to share his perspective on the state of mental health in America, including data from Mental Health America's screening program. Paul?
Thank you very much, and it's a real pleasure to be here with you. I am going to be covering a lot of ground, and I will try to do it pretty quickly. I've been asked to do an overview, and we'll be helping to set up, I think, the subsequent presentations that we'll have today. But I wanted to begin by just noting that each year, Mental Health America writes a report called The State of Mental Health in America. And we draw data from federal sources primarily, and not only for the nation as a whole, but for all of the states. And from our most recent report, some very high-level data reflects something that I think everybody on this call currently understands, and that is that a significant number of American adults, 18%, have a mental health condition. That many of the people, adults with mental health conditions, are uninsured and remain so, even though that number is dropping. While coverage is increasing, access isn't necessarily, because 1 in 5 adults who experience a mental health condition currently reports an unmet need. And there are similar kinds of worries around young people. The rate of youth experiencing a major depressive episode, for example, has increased dramatically over the course of just the last 4 years. And again, the vast majority of youth with a major depressive episode receive no treatment. Part of the problem is that mental health workforce shortages remain. And one of the most promising ways of addressing those shortages, the certified peer specialist, is still getting off the ground. Now, Mental Health America, we are 110 years old. For most of our life as the National Mental Health Association, and we promote mental health as a critical part of overall wellness, including prevention services for all, early identification and intervention for those at risk, integrated care services and supports for those who need them, with recovery as the goal. And understanding that mental illnesses have been, as a matter of public policy, by having a non-clinical standard applied as a trigger to treatment, so-called danger to self or others, mental illnesses have been the only chronic diseases in America that we, as a matter of public policy, have waited until stage 4 to treat, and then often inappropriately only through incarceration. A little bit later on, Kitty's going to reference the 2 systems of care that have evolved in the states. Suffice it to say, they've done tremendous harm to people with significant mental health issues. And we can do better than that with more screening and better integration. When screening's offered in primary care, screening for mental health problems, it's perceived as helpful 93% of the time. Primary care physicians are 3 times more likely to recognize symptoms of mental illness and then follow up. Post-screening treatment changes are made a significant percentage of the time, and positive benefits persist over time. Now, the fact of the matter is we are not screening and identifying and serving our kids with behavioral health needs or our adults with behavioral health needs, while screening should be as ubiquitous as blood pressure screening for adults and as vision and hearing screening for children. The fact of the matter is that it's rarely done. And one of the best indicators of this is the evidence from the Department of Education data for the country as a whole, where in 2015-2016, we identified fewer than 350,000 people between the ages of 3 and 21 for special education services on the basis of the SED label. That represents only about 1 child in every 30 who, according to the National Institute of Mental Health, has in fact or will have a serious mental health condition by the age of 18. We've got to do significantly better than that in the area of early identification and intervention, or we lose too many people. Now, much of the presentation that I'm going to do here will be done from the perspective of people, the individual, the patient, for people who refer that way, the consumer, But we were founded, Mental Health America, by an individual, Clifford Beers, young man with lived experience. And so we often look at things not through the lens of the provider or the system, but through the lens of the individual who is seeking help. And when people first seek help around a mental health condition, they Google terms like, am I stressed or depressed, depression test, or just simply, I want to die. And they don't relate to clinical language. While clinicians will speak of cognitive distortion, stopping stupid thoughts is MHA's most popular webpage outside of screening. Mental Health America offers 4 million screens online that people can take anonymously in those 9 particular areas. And here's some of the general results overview from the screening that we offer. 3/4 of the people who take a screen, we have about 3,000 people a day taking the screen. Screen is positive or moderate to severe for the condition for which they screen. Of that group, 2/3 have never been diagnosed, actually making our database the largest database in the country that is readily available about a health-seeking population that is not yet in treatment, generally, for the services they seek or for the conditions they have. The depression screen, the PHQ-9, is by far the most popular. About half take that, followed generally almost equally by those who take bipolar, anxiety, and psychosis screens. Some of the others come in a little bit lower. 8% of our screens are international. The race ethnicity of our screening population is close to the United States Census, and 35% of our screeners are aged 11 to 17, 32% more 18 to 24. That often stops and surprises people until you remember that half of mental illnesses emerge by the age of 14, 3/4 by the age of 25, making these diseases and conditions of childhood in our country, and our screening population reflects this. Of those who report a chronic condition, which is going to be important for the discussion about integration throughout this hour, 31% report chronic pain, 13% report lung problems, 12% report diabetes. Now that's a general overview of screening, but digging down a bit deeper, if you look simply at the pediatric symptom checklist, which includes 2 of the screens that we have, the parent screen and the youth screen, you'll see some interesting numbers here when you put data from both 2017 and 2018 put together. First of all, on the parent screen, 64% of the young children on whose behalf parents are screening screen at risk for a significant mental health concern or condition. And in the youth screen, 72% screen at risk for a serious mental health condition. Clearly, when people are seeking help, they're seeking help because they already perceive they've got symptoms, they already perceive they need some support and services, but they are not yet getting that for the most part. And one of the reasons for this, we can see when we dig down into some of the youth screening data even more deeply. It's because for the most part, we wait until there are conduct problems. And when we can observe a behavioral problem within a behavioral health condition, such as danger to self or others, at the deep end of that, that's when we array our services, that's when we step in, and that's when we attempt to change the trajectory of somebody's life. But if you actually look at the way people are responding to questions when they are screening, in fact, in the case of young people, the conduct problems come last. You see more of the dark blue there in the never category. It is the attention problems and the anxiety, depression problems, the internal factors that come first, that they are aware of, they are concerned about, and for which they would be seeking help if we gave them an opportunity to do so. And the same is true with all screeners, including adults, when you look at the question breakdown in the PHQ-9, which is the depression screen that we have, and we have about 2 million results with the depression or the PHQ-9. Once again, we often think of an earlier stage indicator of somebody with a serious mental health condition related to depression being suicidal ideation. But if you look carefully at this slide, you see that the suicidal ideation question, thoughts that you would be better off dead or hurting yourself, is the 8th most frequently positively answered question in the PHQ-9. What we should be responding to in integrated circumstances through screening and through earlier identification and intervention is in some of those other things on the list when people are feeling down, depressed, or hopeless, feeling bad about themselves, feeling tired of having little energy, having trouble falling asleep or staying asleep or sleeping too much. And when those constellation of symptoms are arrayed together, that's the time we need to be intervening if we're going to change trajectories of lives and move people away from suicide. So while 32% of the people in that prior slide basically talk about having suicidal ideation either half or nearly every day, and John is going to talk more about this kind of information, suicide, later on in his presentation. In fact, it's not equally distributed across age groups. Half of the screeners aged 11 to 17 report significant thoughts of suicide or self-harm. And we all too infrequently recognize what's going on with our kids. So here's something to keep in mind. It's not a question of there are serious mental illnesses, and those are the ones we need to be focused in on, and then some not so serious things that people will get over. As a matter of public policy, there is no distinction between a traditional serious mental illness and other mental illnesses. All mental illnesses need to be treated and taken seriously from the start. Just digging in a little bit more into the psychosis screeners, because often that is one of the conditions that people universally see as a condition that warrants serious attention for people. 73% of our nearly 300,000 psychosis screeners scored at risk for psychosis. Now, we only identify about 100,000 new individuals each year with schizophrenia for a diagnosis. So most of the people who will be diagnosed with psychosis are actually appearing in our screening population at an earlier stage of this process. And in fact, again, are not in denial about the symptoms they have. They're actually seeking help about the symptoms that they have. They're looking for us to do something on their behalf. And they are more likely to have been diagnosed already in the past with something. But I will say parenthetically, traditionally, they're more likely to have been diagnosed inappropriately with another condition. Now, the whole category of integration is so incredibly important to us because so many other organizations that advocate as we do on behalf of patients or individuals or people with the lived experience of those conditions come to us and say the overlap of mental illness and chronic conditions is really bedeviling to people. How do we figure out? We know what to do for somebody with a heart condition. We don't know what to do with the mental illness that comes along with that. Our conference this year in June is being built around the overlap of mental illness and chronic conditions because it's critically important that we look at these things within an integrated setting, because between 70 and 80% of screeners who have chronic conditions actually screen positive for a mental illness as well within our screening population, ranging across all chronic conditions and to these diseases in America. And in fact, people with chronic conditions have more frequently had a mental health diagnosis in the past. About half of them have, versus, as you recall, only about 1/3 of the overall general screening population. So when people, though, have a combination of conditions, and we need to do something for them. And one of the reasons why the healthcare system hasn't organized itself in a way to do so is because, as people say, they don't know, providers don't know where to refer people for care and services because we don't have an adequate supply of behavioral health professionals, and they aren't adequately distributed around the country. But one of the things that we learned by talking to individuals who are help-seeking is that referral to care and services is only one of 4 things they are looking for. They are also looking for information and education. They're looking for engagement with peers, and they're looking for self-help tools that they can use to maintain their health and well-being. And even when we can't provide a referral to care and services, we can provide all of those additional other categories of support. And at Mental Health America, we're doing some of that. In 2018, we launched a screening support site, 1.5 million individuals, had over 6 million views of content, and the content that we give people after they take a screen, whether they screen positively or negatively, which is customized for them, gives them information and resources in all 4 of those areas: the learning, the do-it-yourself tools, treatment resources, and connection with peers. And it makes a difference to them that we're able to do so from a perspective that they understand, because as I mentioned earlier, words matter. I'm ashamed of the way I am. I want to die. I can't get out of bed. I'm feeling guilty. That's the way they talk about the conditions that they have. So our top pages are not clinical pages. They're pages like, I see ghosts or shadows. I'm afraid I'm going to kill myself. How do I get a service animal? And other kinds of things that health-seeking people are looking for. My concluding thoughts is that mental health problems are common and increasing, even as coverage and access improve. That screening is beneficial, and it can identify issues and intervention opportunities long before stage 4 in the mental health arena, just as in chronic diseases in general, that both children and adults benefit from ongoing screening and support, and that people with other chronic health conditions are at special risk. While support should be person-driven, the answer is clearly not in the further segregation and continuing segregation of our healthcare delivery system into health and behavioral health, but in the integration of care, services, and supports, because that's what leads to recovery. Thank you.